Number 1. Paracetamol. Let's recall how everyday aches trouble you, or fever knocks at your head. Paracetamol steps in as your go-to choice for both adults and children. It works by blocking the inflammation and pain-causing hormones known as prostaglandins. You can get paracetamol in pills, capsules, or even liquid. If you're a grown-up, you can take 500 to 1,000 milligrams every 4 to 6 hours. But don't take more than 4,000 milligrams in one whole day. Otherwise, you can have nausea or liver damage. Most of the time, you can safely take paracetamol with other medicines. If you already have liver problems, some bad infection, or drink a lot of alcohol, it's best to skip it. Now, the mommy part. If you're pregnant or breastfeeding, you can still take paracetamol, but try to take the smallest amount that works. Number 2. NSAIDs. On a cold day, when you feel puffy, hot, and achy, there come NSAIDs like ibuprofen or naproxen. These are non-steroidal meds of kindness but more powerful than paracetamol. You can find them by names like Advil, Motrin, Aleve, or naproxen. They inhibit the enzymes cyclooxygenase 1, COX1, and cyclooxygenase 2, COX2, to limit the production of real troublemaker hormones called prostaglandins. Also, you can combine NSAIDs with paracetamol. But unlike paracetamol, you can get them as gels and even shots besides pills and capsules. When should you say no to NSAIDs? It's simple. If you're ready to welcome a baby at home or have tummy problems, kidney issues, heart trouble, or you're over 65, you should talk to a doctor first. Number 3. COX2 inhibitors. When your body aches in some inflamed area, like joints or menstrual cramps, COX2 blockers work like the sharpshooters of pain relief. With their laser-like focus, they ease the discomfort without too much messing with your stomach, like NSAIDs do. You might know one of them called Celebrex. So, what happens when your body gets some sudden pain at the inflamed site? These bad boys COX2 enzymes gather to have a pain party. However, the COX2 inhibitors rush to stop the biochemical action of COX2 enzymes and pause the pain buttons. Usually, your doctor can advise you to take about 100 to 200 milligrams of these little helpers twice a day for achy joints, and a bit more if you have a really bad kind of arthritis. Even pregnant and breastfeeding women can have them. However, these medicines have a risk factor. So, tell your doctor if you're on blood thinners, like aspirin, before getting COX2 blockers. Prolonged use can have some risks, like heart problems. That's why always take them after talking to your doctor. Number 4. Tramadol. When the pain sets up a camp in your body after surgeries or mishaps, tramadol can take the stage. It blocks the path of pain messages from the aching site to your brain, so you feel okay. You might know it by names like Ultram or Conzip as tablets, capsules, or solutions. Now, this medicine is a bit picky. It doesn't combine well with other drugs. Also, if you've had breathing problems, seizures, or indigestion, or if you're growing a baby or breastfeeding one, this isn't the best buddy for you. Sometimes tramadol can make you feel a bit dizzy or queasy, so don't take it with the recent use of sedatives. Also, it can be tricky because you might start depending on it. That's why it's important to talk to a doctor if you're taking it for a long time, especially if you're older. Number 5. Morphine, opioid. Sometimes pains can get too serious, like in cancers, childbirth, or major trauma. Morphine is the heavy hitter that doctors call in. Being a natural form of opioid, the drug coming from poppy plants, it's more powerful than tramadol. This oldest painkiller has been in use since 3000 BC. You might hear doctors calling it Cadian or MS-Contin. Just like tramadol, but more efficiently, it also blocks the pain messages traveling to your brain from the screaming site, and your brain ignores all pain sirens. You can find morphine in different forms like pills, capsules, liquids, or even shots. Now, this medicine is super powerful, so it's important only to take it when the doctor advises. Don't mix morphine with other sleepy meds. If you have breathing or stomach-related issues or a drug problem, avoid morphine. It can also make you tired and constipated. Long-term use might make it less effective. Too much is dangerous because it can cause problems with breathing through respiratory depression. This may happen at the early stage of the treatment, and the patient may experience shallow or slow breathing. If not treated on time, it can cause death. Number 6. Oxycodone, opioid. For those non-stop pains when you need something potent, oxycodone is like the VIP, 1.5 times as strong as morphine. It orders your aching body to go silent by blocking the pain signals going to your mind. Oxycodone comes in two types. Let your doctor figure out the right amount based on how much pain you're in and if it suits your other medical conditions. Wondering why? It's because it can mess up with other sleepy medicines, and high doses can affect your breathing, leading to death. Yes, feeling sleepy or constipated is the most common side effect of oxycodone. And if you take it for a long time, it won't work as well. Always let your doctor decide if you should take it. Number 7. Fentanyl, opioid. Can you think of the pain that is beyond intense, like in cancers or traumas? Fentanyl is the ultimate lifesaver. Coming from the drug class known as opioid, this Superman of painkillers saves you by blocking the pain messages from reaching your brain. You might see it labeled as Duragesic or Actic. Besides pills or injections, you can get them as a sticky patch through nasal sprays or a shot. But this hero of painkillers has some common issues too. First, using it with other sleep medicines can be way too dangerous. Second, if you have trouble breathing, asthma, or other drug issues, this might not be the right medicine for you. Third, you might face issues like constipation. Also, nausea and vomiting can happen. Finally, your body may stop bothering with the small doses and ask for more. So, it's best to let your doctor decide if you should have fentanyl. Number 8. Neuropathic painkillers. Imagine feeling hot pain or like little electric shocks in some pinpoint area that make no sense. When your body keeps fighting old diseases like heart or diabetes, your body system's signal wires get damaged, and you have false pains. There, ordinary painkillers don't work. So you need tech support for neuropathic painkillers for your body's wiring to calm those signals. Neuropathic painkillers help to calm down those mixed-up signals. A few of these painkillers were initially designed to help with mood, and others with seizures, but work for neuropathic pain as well. They cast a spell to make your mind think that everything is okay. If you have some health problems like seizures or liver issues, you might not be able to take these. Sometimes these medicines can make you feel a bit dizzy or tired, or they might upset your stomach. If you take them for a long time, your body might get used to them, and they might not work as well. It's important to talk to a doctor if you're taking these medicines. Number 9. Lidocaine. Imagine hitting your knee against a desk corner, and you get a pesky pain that just won't stop aching. Lidocaine, also known as a local anesthetic, is like the magic eraser you reach for. A quick and easy solution to numb the area and stop the pain in its tracks. They work like your body's secret agent against pain. When you've got a boo-boo or need a little numbing before a procedure, lidocaine steps in, blocking those pain signals from reaching your brain. You might know it as xylocaine or lidoderm. Lidocaine comes in different forms: creams, gels, patches, and liquids, each suited for various situations. Just a dab will do, but remember, it's meant for small areas. Be careful if your skin is already broken or if you've got allergies. And while it's pretty safe, too much lidocaine can be a problem, making you feel really sick. For kids, older folks, and pregnant or breastfeeding women, a quick chat with a doctor is a smart move before using it. Safety first, always. Thanks for hanging out with us today. Hit like if this video rocked, subscribe for more, and share the knowledge to your core.